More testing is not always better, even when it comes to cervical cancer screening. The American College of Physicians has new advice on when to start, with what test, and how often to screen women at average risk for the disease.
ACP's advice is designed to maximize the benefits and reduce the harms for cervical screening in average risk women. What it means is that frequency of testing, the initial testing age, and when to stop testing are important. Historically, physicians have started testing too frequently, too early, and they haven't stopped at the right time. This yields to potential of harms.
The new advice paper published in Annals of Internal Medicine lists two concurring organizations, the American Congress of Obstetricians and Gynecologists and the American Society for Clinical Pathology. ACP offers this advice for screening.
For women at an average risk, ACP advises that screening start at age 21 with cytology for cervical cancer. Then at age 30, HPV or human papillomavirus screening and cytology can be combined. Subsequent to that, patients can be screened every 3 to 5 years depending on their personal preference, and this is a discussion they need to have with their physician so that they can have a shared decision making.
Women of any age who had a hysterectomy with the removal of cervix should not be screened for cervical cancer. Average risk women who are over 65 who have had several negative test results can stop being screened.
The likelihood of a woman having an abnormal test for cervical screening depends on the age and the frequency of the testing. ACP recommends testing at the right age, at the right intervals, at the right time.
The harms of unnecessary screening can be significant.
The harms of screening are discomfort of examination and undergoing the tests. These would be pelvic discomfort, sometimes bleeding, and then also, for women who are of younger age, it leads to obstetric complications during delivery. So these are unknown harms. In addition to that, over-testing has been shown to increase the procedure rates like colposcopies, biopsies, and cone biopsies.
By following ACP's best practice advice, physicians can practice high-value care by reducing over-screening, over-treatment, and unnecessarily higher costs.
ACP's advice is for average risk women who are asymptomatic to have a discussion with the physician about the frequency of testing and when to stop testing.
ACP's advice applies to women without symptoms who are at average risk, such as those with no prior history of a precancerous lesion or cervical cancer. For more information, go to acponline.org.